Each year, more than 500,000 Americans have gallbladder surgery due to chronic gallstones. We spoke with Dr. Peter Jamieson of Desert Regional Medical Center in Palm Springs to find out why we develop gallstones and how they can be prevented.
Millions of people have gallstones and they don't even know it. Clinically asymptomatic. What happens is that the bile, which is stored in the gallbladder, precipitates or gets saturated with the cholesterol or other pigmentations that are brought into there. And what happens over years, they precipitate out little flakes, what we call crystals. And then what happens is they go ahead and they form into small stones or even larger stones, even the size of golf balls. The gallbladder basically is a reservoir. It stores bile, nutrients, electrolytes, and then when we end up having, again, greasy meals, fatty meals, it breaks those particular products down in our GI tract. And when it's not functioning, it can't. That's why there's a strong correlation between those meals and having pain.
We asked Dr. Jamieson who usually develops gallstones.
There are several different categories. One, if you take young females that are pregnant, we can see it after pregnancy. Second, we see a huge wave in terms of people that diet and lose a lot of weight very quickly, especially years ago when the Nutrisystem kind of diets. Third, strong family history. The idea that they always have to be female and obese, and that's usually not the case. We see a significant amount of males also have gallstones and need to have the gallbladder removed. But again, there's different categories of people. It's not always just one subset.
Dr. Jamieson told us about the symptoms that might indicate gallstones.
Usually they present to their doctor because they've had a history of different foods make them feel bloated. They can have, sometimes they go to the emergency room because they think they're having a heart attack. They have substernal chest pain. They can again have nausea, vomiting. They can have fevers. Those are usually the things that take them to the emergency room when it doesn't get better. A lot of times these problems go away in about 3 or 4 hours. They feel better and then they go home and they're fine. But a lot of times it takes them to the emergency room. You can control the symptoms with if you stay away from a lot of greasy foods, fried foods, spicy foods. Gallstones are diagnosed usually by an ultrasound, that because the patient has abdominal pain, they've had nausea, vomiting, bloating. They go to their doctor, they get an ultrasound done, and that's usually the first test that's done.
What are the treatments for gallstones?
The treatment of gallbladder disease can be non-operative, usually again can be diet controlled, especially for those patients who are not surgical candidates. Generally speaking today, the operation of choice is a laparoscopic cholecystectomy. When you came in for a laparoscopic gallbladder, the operation is done during that particular day. I keep my patients for overnight just to monitor the nausea, the vomiting, and all the symptoms that can be taken care of. They're sent home the following day once we check their labs. Generally speaking, they're up doing whatever they want to do in about 3 to 5 days, usually back to work within 1 week.
And what can a patient expect after having gallstone surgery?
Usually what happens, the only thing that when I see my patients is that they have to stay on a low-fat, low-cholesterol diet for about 6 to 9 months. That takes the liver that long to readjust itself and allow itself to break down the fats after we have those particular kinds of meals.